Hey there, it's Dr. Matt Link here from the Walton Clinic of Chiropractic, and I wanted to address a question that I had earlier today from one of my patients. Her name is Deb. She was actually asking about her husband that had been to his medical doctor recently because he was having lower back pain. Medical doctor did an exam, took some Xrays, and told him, hey, you got degenerative disc disease. So her question to me is, what causes degenerative disc disease? Because according to her husband, he had never been in any accidents and never had really any issues, just an occasional lower back pain that would occasionally get worse and worse and worse over time. Now, first of all, degenerative disc disease isn't necessarily a disease per se in the way that we typically think of a disease. You know, it's like cancer, you know, starts in one area of the body and then just really spreads. But it can spread, and I think that's why I would consider it a disease, because what happens is one area of the spine starts to degenerate and decay, then other areas of the spine need to make up for that lack of motion, and then they start to degenerate and decay. And then again, that becomes a disease where it spreads and spreads and spreads and becomes more and more of a problem as time goes on. And that's what most people don't understand or realize is a little bit of low back pain here and there is a warning sign for more problems to come. Now, again, coming back to the question, what causes degenerative disc disease? Okay, well, that can be broken down mainly into three categories, with the main category there being a physical stress. Okay, now, physical stress can actually be broken down into two categories. First one being a hard, fast stress. So something that happens like a car accident. You get into a car accident, boom, boom, you get that whiplash, that thrust that causes your spine to lock up. Maybe you fall off of a ladder, you slipped and fell on ice, down the stairs, something like that really produced an impact to your body that causes joints to lock up. Now, the second physical stress that I would consider would be a long, drawn-out stress. Maybe something that's repetitive, something you do day in and day out, such as sitting at a computer for hours on end. That produces a lot of stress. There's research that shows the more and longer you sit increases the pressure between the discs of the discs in your spine. Maybe you're a dentist or a dental hygienist. I see this a lot too with a lot of our patients who they lean over their patients day in and day out. Maybe you're a mechanic who leans into underneath a piece of equipment, or an HVAC person who works in tight spaces as well. I could go on and on and on about all the things that we do day in and day out that produces stress. Maybe you sleep in a bad position for hours on end, and that's producing stress on your spine. All these things that we do need to be taken care of and corrected on a regular basis. Okay, so that is essentially what causes degeneration of our spine. Now let's take a look at the spine here real quick. So if we take a look at some bones in the disc, okay? Now there's 24 bones typically in an adult spine, and there's a disc space in between. So you can see here are two bones with the disc space in between. See how nice and thick that is? That gives your spine some cushioning. Also creates a space for the nerves to come out from your spinal cord to go to all parts of your body. Okay? So that's how thick that space should be to give your spine some cushioning. But what happens is, maybe, like I said, those two types of physical stress occur, and that starts to cause that space to degenerate and decay. See how that gets narrower? So we start losing that cushioning because there's no good motion in the spine to get and keep that disc healthy. Okay? Now, like I said, Deb, who was in earlier, she was talking about her husband, didn't have any stresses, works as an accountant, so he does sit all day at his computer. But she was also saying that the doctor told her, or him, that he's getting older, so that's why he's got degeneration of his spine. Well, I'm going to have to disagree with that. okay? And here's why. And I can prove that right here with these two x-rays, okay? Now, this first x-ray, I apologize, it's hard to see with that, so what I'm going to try to do is take a picture of it and post it in the comments below, and then make some notes as to what's going on. But this patient of mine, she's in her 30s, she's having lower back pain, okay? Now, in the x-ray, you'll see that the very lower portion of her spine is showing some significant area of degeneration of the disc, okay? But if I go just a couple joints above that, the discs look great. She's doing great because that part of the spine is still moving like it's supposed to. Now, what I'm going to point out is every single joint in her body is the exact same age. She hasn't had any replacements or anything. So that goes to show that when there's a trauma, whether, like I said, be a fast, hard trauma or a slow, drawn-out trauma, it can start to cause certain areas to lock up and degenerate. So it's not necessarily an age thing, it's what's going on and what happened to the body. Now this other x-ray, this patient, she is in her 70s, okay? And as you can see, she has had some spinal surgery. And yes, we can work on patients who have had spinal surgery, just FYI there. We do different techniques, work on different areas that we need to. All the reason is to continue to get motion and keep whatever motion there is left in the spine. Because what's happened, like I mentioned earlier, degenerative disc disease can spread, okay? This patient, she had issues in the very lower part of her back. So years ago, the doctors decided they needed to do surgery and fuse this area, okay? Then over time, the areas above it started to work harder to make up for this lack of motion. Now, she's got extreme degeneration going up the rest of her spine. And that's unfortunate. If that spine's not taken care of, it'll degenerate, okay? Start having a little bit of pain here and there. Then it starts becoming more frequent. Then it starts becoming more intense as well. More and more problems, okay? So again, recapping, degeneration, physical stress. First thing, hard, fast stress like a car accident. Second thing, a slow, drawn-out stress, sitting, working in a repetitive position, sleeping in a bad position. Those things over time can cause your spine to degenerate and, as you can imagine, have more problems, okay? So, in the video that I'm going to do later, we're going to talk about what can we do to counteract the effects of degeneration to help your body function as like it's supposed to, okay? So I hope you got something out of this video and hope you can get yourself taken care of and make your body function as well as it should be. So again, this is Dr. Matt Link with the Walton Clinic, and I'm reminding you to stay healthy, Springfield.